From hamburger disease to the contaminated water supply in Walkerton and tainted spinach, E. coli bacteria have become rightly feared as a threat to Canadians' health. One strain, O157H7, is often excreted or shed by cattle in their manure. When this strain of E. coli infects humans, especially children and the elderly, it can be fatal. But a Canadian discovery, the result of research at the University of British Columbia and a Canadian biotech company, has led to a vaccine, the first of its kind that could drastically reduce the amount of E. coli O157 shed by beef and dairy cattle and, in turn, reduce human health risks. Dr. Brett Finlay of the University of British Columbia led the team that discovered the technology which enabled the development of the vaccine called Econiche.
Yeah, cows carry O157, but they don't get sick. Where the disease comes from is people encountering contaminated products, either food or water type items that's been contaminated by cow feces. So if we block the colonization of cows by O157, we basically decrease the number that humans are exposed to and then drop the disease levels in humans.
6 years of clinical studies have showed that Econiche can significantly reduce the amount of E. coli shed by cattle. The vaccine was just approved for use by the Canadian Food Inspection Agency and is given as a simple injection to cattle under veterinary supervision. Kim Anthony, owner of specialty beef producer Top Meadow Farms, is one of the early users of the vaccine.
We've been trying to do our part to be an industry leader in food safety. Everything that we've done at this farm and this beef operation has been about food safety. The E. coli vaccine, again, fits into that. It's been a missing link in the industry thus far.
When humans become infected with this deadly E. coli strain, the consequences can range from abdominal pain and severe bloody diarrhea to kidney damage and even death. Young Nathan Robert is a survivor of a devastating E. coli infection.
The blood tests are the things that indicated to them that there was something seriously wrong, and then they told us that it was probably E. coli that had caused him to develop a disease was called HUS.
HUS, or hemolytic uremic syndrome, is a disease that affects the kidneys and other organs. It poses a substantial threat to the elderly and children, for whom it is one of the leading causes of sudden acute kidney failure. Dr. Colin White is a pediatric kidney specialist at BC Children's Hospital in Vancouver.
I've probably taken care of between 60 and 80 children and their families with this condition. And certainly it's one of the more challenging diseases that we face as pediatric nephrologists.
Simple vaccination of cattle with Econiche can help avoid consequences associated with human infection with E. coli O157H7. Producers who want to learn more about Econiche should talk to their veterinarian. Bob Harding reporting.